You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is Houston's go-to dental implant dentist. We've had him on the program before, Dr. Michael Tran. Dr. Tran, welcome to the program.
Thanks for having me, Randy.
Now, we should mention every single thing we talk about today. You teach and lecture and teach other dentists across the country this implant process that you've kind of pioneered. First off, who's the typical patient that comes in for dental implants?
So the typical patient that comes in is really, there's two categories of patients.
Okay.
First, you have the patients with teeth that have been suffering for a long time. Actually, just yesterday, we had this patient come in and we take his x-rays and you can see a lot of infections. You can see he's been to the endodontist multiple times. But the problem with that is now his teeth have been infected and the teeth are broken off, and when he smiles, you see black teeth in the front, he's missing teeth in the back, and he has a lot of pain, has a lot of gum disease for not going to the dentist. So at that point, his teeth are not salvageable. So he's got to get a brand new smile with dental implants. So when I talked to him, I asked him, how did he find us? And then somebody in his family said that, you're going to get married. You can't get married like this, man. And then he tells me, and he was so thankful. He was even crying before the procedure because he thought he was going to get a new lease on life. And he turns to me after the procedure, after we take out all his teeth, he says, man, you just didn't know, but I have less pain now after this surgery. This is right after the surgery. Less pain now after the surgery than before the surgery. But he said he didn't even want to get married because he was embarrassed of his teeth. And now he's just so happy. He actually texted me this morning on the way here.
Okay.
He says, thank you so much. I feel like I have a brand new life.
It's nice. That's nice. So the typical patient, and we've talked about this, that you say that they feel like they're going to end up in a denture. Like their teeth are so bad that they're almost kind of like hopeless, or as you say, without hope. So that's one group. They come to you because they don't want a denture. And then what's the second group?
The second group, the first group is patients with teeth, and the second group is patients wearing with no teeth and having a denture that's ill-fitting and always rocking around when they're chewing. They can't taste any food. They've got the denture that's covering the roof of their mouth so they can't feel hot or cold, can't taste their food anymore. And the honest truth and reality is that they only have 1/4 of the biting power before. So instead of wanting to eat what they want, they're eating what they can, and that's not really the life that most of our patients want to live anymore. So they come in looking for a solution, and we change a lot of their lives.
Now with the denture wear, for
Yes.
a second, and correct me if I'm wrong, you've told me that on the day of the procedure, they could walk in with no upper and lower teeth, and that day go out with upper and lower teeth that don't come out. Is that rare, or that happens a lot?
That happens all the time. And you said that 4 years ago, you interviewed me. You know what's changed in 4 years?
Yeah, what's changed?
And I'll tell you, we would do teeth in the same day, or a lot of times do it the next day. Most of our patients get teeth the same day, and now if they're doing a single arch. If they're doing both arches, for example, let me reverse back a little bit. 4 years ago, to make our teeth, it would take 4 hours to 3D print the teeth. Now with changes in technology, we'll 3D print your teeth, and it comes out 3D printed in 20 minutes, and we'll stain it and characterize it, and you'll come out with a brand new smile in a couple hours.
So you do everything in-house?
Everything in-house, start to finish.
Now, also, is this true? The way dental implants are typically done is you go to 3 places. One place that does the surgery, one doctor, and then another doctor that puts the teeth on top, and then you maintain them elsewhere. Your office, you do all 3 parts. Is that why you do it so fast?
We do it so fast because we control the whole process. So patient comes in, I do the surgery, do the implants. Most of my team is very, very trained. They take over the rest of the part. We have the in-house lab, the ceramics in-house. The assistants are very trained to deliver temporary prosthesis. And then after that, our hygienist in-house will take care of the patient the whole time.
So what's the process? So the 2 categories, somebody they still have their teeth, but they're so bad, they have to be removed. They don't want a denture, or the denture wear. When they go to your office, you said it's a 2 to 3 step process.
Correct.
What's that like?
Well, it's very, very easy. You make an appointment at our office. We'll come in. We'll give you a tour of the office. We'll take a 3D x-ray, and then we'll take some photos. And then I'll come in once the records are taken. And then I'll come in and give you a customized treatment plan, see if you're a candidate for dental implants.
Okay.
We'll get to know each other. Then we'll give you a price. And then from there, if we agree on everything, then we'll do your surgery and you'll get your brand new set of teeth.
Okay, so it can be done with as little as 2 visits to your office, and then they get their new teeth. In fact, if you had an opening in the schedule, I'll put you on the spot here.
Yeah.
Somebody watching this,
Okay.
they could come in tomorrow, and the day after that, they can get their new teeth,
That's
upper and
correct.
lower teeth.
That's correct.
Is that right? It can be done that quickly.
Yes.
Because of what? The technology? Because
tech-
everything's done right there?
The technology, we've done thousands of these cases. The procedure doesn't take that long anymore. Just everything is streamlined. All of our team is trained. All of our lab, our in-office lab is very, very trained. And it's just something we do every day. It's like you waking up and brush your teeth. That's me waking up and doing the surgery every day.
So you teach this, and we've mentioned this before, but this process this is what you're teaching on the road all the
Yes.
time. I mean, you're here in California. You were doing a course out of the country as well.
Yes.
So this is what you're teaching all the time.
That's correct. We're using the latest and greatest technology. Our institute was actually the first one in the world where I was doing what I was doing in my office, but it was the first one in the world that we had attendees using all their same technology to do the surgery, to 3D print the teeth and deliver a same-day smile to the patients that came to our course.
How important is experience? I mean, it seems like an obvious one, right? But how important is it? Because there's a lot of guys breaking into the business. You've explained to me.
Yes, definitely. A lot of people are getting into this, but as you're going to see, like during our surgical course, everybody has to start from somewhere, right? So we're training the doctors to do the surgery, and they might take 6 to 8 hours, and I'm only taking a fraction of that time. But in surgery, we know that when a procedure is quicker, you're going to get a lot less post-op pain. You're going to decrease significantly the chance of infection. So experience, you'll both get the job done, but laughing 4 years ago, I'm a totally different surgeon than I am 4 years ago. So, and when you interviewed me, I was very, very confident. I'm just more confident now that I can do it a lot better and faster.
Okay, good. Now you say it's life-changing, and you brought some proof. You've got some photos. What are we looking at here?
See the photo right there? That patient, when we first started, is a totally different patient now. But when he came in like that, he's having a lot of pain. He can't eat. He doesn't have any back teeth, and everything's just infected. So one of his options were a denture. And a previous dentist told him that he would have to extract all his infected teeth, have a healing denture for 3 months, and then after that, place the implants, let those heal for months, and then he could get his fixed set of teeth. When he came in, he was very, very shocked and surprised that I told him that we'll get him out of pain and we'll give him a brand new set of teeth.
Okay.
It's that easy.
So what did you do for him?
I took out all his infected teeth. Well, first, we took all the records, and what makes us unique is we're doing a digital smile design. So people are always scared or concerned about they're going to get horse teeth or whatnot. And that was like the analog where we just sent this putty impression to the lab. And I promised all of my patients that they're going to love their smile and be happy with it, is because once we take our photos, and sometimes we take 3D facial scans, and it's like we're in a digital age now where we're designing the teeth for every single patient. So all of our teeth are custom designed to your face. So nobody has to be
So
worried.
they see what they're going to look like in advance.
Oh yeah.
So you show them their face with their new teeth. What do they say? What's that like for them?
They say, "Is that really me?" Or they say, "Is that even possible?" And I said, "Yep. The next time you come here, you're going to be walking out just like this."
Is that right? Okay. So with him, again, his option would have been a denture. And so you give him what? What do you do for him?
So most of our patients are sedated. We get him numb. We extract his teeth, clean out all the infections. Usually a lot of these people are suffering with the infections. That's what gives them a lot of pain. And then we place the implants. We use our digital technology. We take a quick digital impression, and then from there we design his teeth. And then we 3D print the teeth, which is amazing now from 4 years ago to now. And it's just a lot quicker process, and they leave with a brand new smile. So I want you to take a look at the after here.
Okay.
Look at the before picture. This is a totally different gentleman, and look at he's smiling. Before, we noticed this a lot. Patients don't want to smile. They're so used to not smiling, and I have to tell the patients, you're going to have to get used to smiling and people saying you have a beautiful smile. And look at this after picture. You see how much
He
he's
looks
smiling?
a little younger as well, too. A little more
I'd say
handsome.
a lot younger.
A little more handsome. And what's that like when he saw it? Like, for example, I guess when it's done and he's looking at himself in the mirror, what's that like? What do they say?
He's totally different. First, most of the patients are always crying because they can't believe they're smiling now. So they have to fight their natural reaction to not smile. And then once they see their teeth in the mirror, they can't hold back. They're smiling, and usually a lot of tears of joy are coming out. But then after that, a lot of patients don't want to come to the dentist. That's the honest truth. But now we've had so many patients that once they get their teeth, they love coming to the dentist. So when he comes in now and he comes up with his follow-ups, our whole team notices the difference in him before and after. And we see that with most of our patients, all of our patients, honestly.
So you say that you sometimes prejudge them, like maybe they're serious or very little sense of humor. And once they get their teeth, all of a sudden, that changes. Is that right? I mean, you see
Randy,
that?
honestly, it's crazy the amount of stories that I've heard now, because I've heard some patients say, you know what, at work, people thought I wasn't that friendly, and they told me they were kind of reserved in their smile. And then after I give them their teeth, they come back and says, you know, I've got a promotion and a raise. And I'm like, why? He says, I just started smiling, and my bosses told me about that. And after I got the promotion, they said, you're smiling more and you're friendly. And I had to explain to them, I got a brand new set of teeth, and now I'm smiling more. I'm still the same person. So when you look at this guy, he didn't like his teeth for 20 years. They've just been getting worse and worse and worse until the pain became unbearable. And he said he just wants to get healthy and get out of pain. And a lot of guys tell me that too.
Like they don't care about the looks.
They don't care about the looks. But then, as we say, form follows function. We've got to design the teeth to look good, and that's why he looks younger. So because the teeth actually give yourself a mini facelift, and you're also getting function from it. So you're going to look younger, and then once they get their teeth and they're smiling all the time, they always tell me the same thing. Why didn't I do this sooner? Why was I living with those old teeth for 20 years when now you can come in and get a brand new smile the next day?
So in a way, he lost out on a bunch of good years.
Oh, definitely.
Without smiling. So his whole identity changes.
Oh, for sure. Confidence goes up. It looks more handsome for sure. Wouldn't you agree?
Yeah. It's definitely very, very nice. Now, you have more photos.
Oh.
I don't want to rush you, but we're short on time.
This patient said the same thing. He just never had a nice smile. And then when he neglected his dental care, and then we gave him the implants, and we gave him a brand new smile, and he just had tears of joy and says, I've never been able to smile like this.
Looks totally different.
Yeah.
So when this, like for example, just for the sake of our conversation today, like all of these patients, their teeth were so bad, they probably would have had a regular denture. Is that correct?
That
was their option.
That's correct.
So these teeth are removed, new implants are placed, teeth are put on top, upper and lower, and that's what you're seeing here. And how many visits? Like 3 visits, you said?
3 visits for the main visits. We have some post-op visits in between there, but most of the work gets done in those 3 visits.
And then they just come in like every 6 months and get their teeth cleaned, just like they're their own teeth.
That's correct.
What about eating? How soon can they eat?
They're going to eat right away. Once they get their brand new set of teeth, they're going to be able to eat.
Okay. Do they ever tell you eating stories, or do they ever call cautious, like, Dr. Tran, are you sure I could eat a steak?
Oh, yeah. So they will be on a soft diet for the first 6 weeks. Put them on a soft diet, and after that, they're going to be able to eat whatever they want.
And do they?
Oh, yeah.
Do they gain weight or do they lose weight?
That's an interesting question. Because honestly, remember, most of these patients are only able to eat soft foods, starchy foods like mashed potatoes and things that aren't really, really healthy. But then once they get their teeth, I find out now they're caring more about their looks. But the main thing that patients have told me is now they can eat steaks, they can eat meats. So they're not eating all these starchy foods that was making them gain a lot of weight.
I like your joke that the most expensive part about this procedure is going out to eat all the time.
Definitely.
And traveling. It's like that, like those Bosley commercials where the guy gets his hair and he's hiking and running and dating. Is it the same thing with this? Like when they get their teeth?
Definitely. I think it's more than that. I think you're smiling all the time. The hair gives you a little bit of confidence, but people don't realize it takes a lot more muscles to frown than to smile. So now you've just got all this energy and you're smiling all the time, and you're smiling, you're always eating.
It almost sounds like an exaggeration, but this is kind of like the world you live in.
Every day.
All the time, all the time. Okay, so more photos.
So look at this next patient. I mean,
right.
Honestly, her teeth look pretty good.
Yeah, they
from
do.
The start, but until you start diving deeper and looking at the x-rays, you wouldn't see all these infections. So honestly, her daughter didn't understand why she wanted this procedure, but then when I looked at the x-rays, I knew right away. You just know. You see the x-rays and you're like, oh, she's suffering.
Did she say she was in a lot of pain?
She was. She did.
And her daughter didn't realize that?
You didn't realize it because they don't want to show that weakness sometimes. But then, so they come in and they're suffering. And so, but her teeth look pretty good. But then after we clean all the infections, we get her a brand new set of teeth. And then afterwards, her daughter realized that she was really suffering, and now she can really smile and
looks
be
good.
healthy.
It looks good.
And plus, when we look at those x-rays and you have all those bacterial infections, you can floss, you can brush as much as you want. There's nothing that you can do to take out those infections unless we take out those infected teeth.
So it's not like they're not brushing oftentimes. It's just they have an infection that they can't brush or floss out.
That's correct. The cavity gets too big, or the infection or the gum disease gets too big, and by that time there's nothing you can do at home unless you see a dental professional. I want you to notice something that is honestly the hardest part of our pre-op records, meaning we ask patients to take a smile, and they always smile, and they smile halfway, and then we have to get the full smile so we can design their brand new smile for their face. And patients are always have that guarded smile, And then look at the
I
after.
could see that. Yeah, yeah. It is a different look on the before and after as far as smiling goes.
Yep, definitely. So that is one of the things that is a little bit uncomfortable with some patients, but we have to assure them, hey, we want to get the best looking teeth for you. So then we have to get them to say cheese, and then afterwards it's always worth it.
Her daughter was skeptical. Did you ever find out what the daughter thinks now?
Oh, the daughter says, she didn't realize that her mother was suffering from these infections, and now that she sees she's smiling all the time.
The new version.
Oh yeah.
Okay, good.
Let me show you this next patient.
All right.
So when she's smiling, she's got a beautiful smile, but she has a denture in this. So sometimes she wears her denture and sometimes she doesn't.
So she had an upper denture.
She had an upper denture.
Okay, okay.
But in this photo, you can see that it doesn't even show her teeth. So many times she doesn't even wear the denture because it's uncomfortable. It's moving around.
Okay.
So, but now, once we place the implants, we give her a brand new smile. Look at the difference. So now you can see her upper teeth. You see a big smile. And you know, honestly, when you see your upper teeth and you see your teeth, that gives you a lot more youthful appearance. Not only is it supporting your face and giving you less wrinkles, but showing what we call the incisal edge, showing your teeth just brings you back 10 to 20 years.
And she can eat whatever she wants.
She can eat whatever she wants. Let me show you this next patient. So after we got done with the procedures, he told us that he had a bad bite and he couldn't really chew right his whole life, really. So afterwards, we do some procedures in our office, like we'll put you on a computer and we have got technology that we adjust your bite and we can see 50%, and sometimes we put a patient on the bite computer and it'll say 80% one side and 20% one side. So we know right away they've been suffering their whole life. And that's what we found with this patient. But he didn't admit it to us until after the procedure. Once we put him on the computer and we adjusted his bite, it's really one of the things that makes us unique. And you can see how much he's smiling more on the after photo.
So what did you do for him?
Just like our other patients. We take out all the infected teeth, all the worn down teeth. That's why you don't see any teeth in his mouth really when he's smiling. So at that point, he needs a brand new set of teeth with implants. We place the implants and we give him a brand new smile.
So they're a little sore afterwards. They're numbed up when they get there. You're doing IV sedation, and you say like they have almost no memory of the procedure.
That's correct.
And then they get a ride home.
Yes.
And that's it.
Yep. So you'll have to get a ride to and from. So you have a driver. You'll get the sedation, and you'll wake up with a brand new set of teeth.
Excellent. Okay, time for more photos. I'm going to rush you a little bit because I want to get all these in.
Okay. So here's a patient that honestly is a very complex case because her lower teeth are touching her upper gums and her top teeth are touching her lower gums. So we got to fix her smile and her bite. So we place the implants, doing our same process. It's like waking up every morning for me. And we place the implants, deliver a new set of teeth, and she looks like a totally different person.
Very nice. Yeah, she does look a little younger because you say they look a little younger, but I think legitimately she looks a little younger.
It's a funny thing because we always show the patients, we blow it up on the screen on the TV beforehand, and then we give them their smile reveal and they'll see it. And once she saw her photo, she was smiling, she loved her smile, and I said, look how you looked before. And she didn't believe that was her in the past.
Like they forget how bad it was.
That's exactly right.
Is that right?
Yes.
And she was like legitimately saying that's not how it was.
She actually didn't believe me. I had to pull out my phone because we take some videos just so we can design her teeth better. And I showed her on the phone that was her teeth in the videos. And she was like, that's how I looked? And that's what we get.
Now, at the top of the show, and people need to know, look, I'm trying not to endorse you, but I know a little bit about your reputation. I know a little bit about your work. I've seen patients. I did some research on you. I've seen the video testimonials. And we said at the top of the show, you are Houston's go-to implant dentist. Do you believe that? Are you doing it at the highest level?
Definitely. We always do everything at the highest level, and that's what our institute, we teach other doctors to do, the same thing that we're doing in our office. Here's another patient that came in. You can see one of the anterior teeth are missing, and a lot of patients have a lot of pain, and until the front teeth breaks off from the infections, then that motivates them to come to the dentist because that affects their smile. So a lot of times, like the previous patients, they're having a lot of pain, but they can still smile. But now, once she lost that tooth, she said, I'm tired of suffering, and I want a brand new smile. So we do the same thing, get her sedation, take out her teeth, and she gets a brand new smile.
And she can eat whatever she wants.
She can eat whatever she wants. So this is a patient that works all night. He works a graveyard shift, so it's hard for him to come to the dentist. So over time, his teeth were wearing out, and he just wasn't able to make it to the dentist because of his schedule. So then he finally gets the courage and wants to come in to take, same thing. He has a lot of pain and he can't take it anymore. So he has to come in, and I always remember him because he comes in 2 hours early and waits because he's just getting off of work. So we get him a treatment plan, he accepts it, he's excited for it,
By the way, that's him smiling before? Because it almost looks like he's grimacing. Like it's hard for him to smile.
It's hard for him to smile because he's grinding down his teeth into
Okay.
little nubs. So when he smiles, we have to get them to get a big smile so we can digitally design their teeth. And it looks like that. But then once we get their teeth back to the original shape and length, they look like a whole different person.
Looks very nice. So both upper and lower teeth?
Both upper and
You get-
lower.
okay, so I understand this correctly. So on the lower, you can do as little as four dental implants, and you could make a full arch of teeth on top of those, and 4 or 6 on the top, just 4 or 6 implants for a full arch on the upper.
That's correct.
Is that correct?
That's correct.
So when they say terms like all on 4, what they're meaning is a full set of teeth on 4 implants.
That's correct.
Is that right?
Yes.
And that's kind of what you're doing with all of these people.
Most of these patients are getting 6 implants on the top. We try to put as many implants as we can. Doesn't matter. Price is the same, but as many implants as we can fit, that's what we'll do for the patient.
But it's typically 4 to 6.
Correct.
Okay, good. So time for more photos.
Let's look at this next patient. You can see missing teeth. So this is a combination case where we do some crowns and veneers and some missing teeth, and we give them implants. But the same thing, we're giving them confidence, Randy. You know, you told me it's just teeth, but when you see their smile, you can realize it's more than just teeth.
Now that smile on the after fits her like mouth perfectly. How much was that? You got lucky that day, or is that all done on the computer? How does it fit so perfectly?
It's all done on the computer. We match. Okay, let me an example. I don't want to get too technical.
Okay.
But if somebody has a rounder face, we're not going to put square chiclets on their face. So that's why we have the photos and the videos, and that's why I said that's the hardest thing sometimes is when patients don't come in and aren't able to smile. They have that guarded smile, but I have to assure them that it's going to be worth it, so we have to get them to smile. But then afterwards, when we take the after photos like this patient, the funny thing is this patient wanted to take the photo with me. So we come in and we have to force them to take the smiles, and then she asked my friend, can I take a photo with Dr. Tran? So that's the difference.
So that's a combination of some veneers. You were able to save some teeth as well.
Correct.
And do that.
And implants in the back, yes.
Okay. Is it more men or women that are coming in to do this?
It's about the same, honestly. The tooth infection and the pain affect both the same way.
Okay.
Look at this patient. So we don't ask every patient, so we can take some video testimonials. But this patient said, Dr. Tran, I've seen your other video testimonials where everybody's praising you, and that's how I came in. Can we please take a video of my teeth afterwards? That's how happy he was with this smile.
Okay. Okay. And where do you find that? That's on your website or
It's on my website, and then we'll see some of our landing pages on our social media, on my Instagram.
Time frame could be as little as 3 visits, or even as little as 2 visits, you say, to get your new teeth. And what about age? How old? Like, what's your oldest patient?
Well, my oldest patient is actually 95 years old.
Really? What'd you do for him?
He had dentures, loose-fitting dentures. We gave him dental implants and gave him a brand new smile so he can eat again.
Upper and lower. Now, why would a 95-year-old want to do this? Like, what's their motivation?
Randy, it's like everybody else. He wants to eat. He's lucky enough to make it to 95.
Okay, that's fair.
And he wants to eat just like everybody else.
So when you hear like a 75-year-old in your office that says, I'm too old.
Oh, we get that all the time. Some
Really?
people say, I'm 75 years old. I'm only going to live for five more years. That 95-year-old lived 5 more years. So I tell him, you're still very young in the grand scheme of things. The honest reality is we're all living longer.
Now, scientifically, though, I'm sure there's data. Are they more likely to fall out if it's an older person, these dental implants?
Not at all.
Or it's not true?
It's not true.
Okay. So that's not a reason for not doing it. What about people with bad gums? I mean, they have gum disease, bleeding gums. Aren't their gums too weak to support implants?
Actually, most of our patients that come in have gum disease, and that's why they're losing their teeth, and they just don't feel any pain. So once we take out their teeth and place the dental implants, their gums get healthier.
So the infection goes away.
We have to take out the infection, and it goes away, and their gums get healthy.
So are people are you seeing a bigger wave of people, because the word on the street is about dental implants, that a lot of people are doing this for their health? They're doing it because they want to get rid of this gum disease?
Very much so. So a lot of patients have seen that there's a link for when you have gum disease, you can have heart disease and Alzheimer's.
Because it's an infection, right?
It's an infection, and it's spreading to the rest of their body. So that's gotten really popular, and a lot of people are reading those things. So they're taking out their teeth so they can get better health.
New teeth. And do they report like more energy? Because I guess like any infection, it robs you of a little bit of your energy. Do you hear that? Like they feel better?
Because we only have limited resources in our body. So if your energy is fighting these infections that you can't win unless you take out the teeth, the patients Combination of things. They have more energy because their infections are gone, but now they're able to eat what they want, so they have more energy in that regard too.
And we got to bring up the cost.
Okay.
So, because it's really a cash out of pocket. Dental insurance doesn't cover it. Medicare, Medicaid doesn't cover it. So what's the answer?
People are financing it, not in just my office, all across the country. We're making it affordable for the patients to get their brand new set of teeth.
So you have people in your office that are setting up finance plans,
Definitely.
like with banks or lenders that lend on this kind of a thing.
Yes. You have to have decent credit, but we're going to make it affordable so you can make monthly payments on it.
So would you say, what, 80% of the people are financing these procedures?
Probably about 85%, somewhere around there.
85%. Yes. So to make an appointment with you, right? Okay, they've heard what you have to say. Do they go to your website, make an appointment there, or just call? What do you prefer?
They go to our website. That's very easy for a lot of patients. We have an online scheduler, or a lot of patients just call the office too.
Now, you knew you were going to be on the show, and you're flying over here to do this from Houston. What's the main message? Like you probably thought, like, I want to make sure I bring this part up. Is there anything that comes to mind?
Just the surgery yesterday. The patient was just crying in tears, and it was just, we do this all the time, and sometimes we realize the patients tell us that, you know what, I told you I got that text message, that we're actually changing their lives, and that we're actually doing a good service for them. And then if somebody wants a brand new set of teeth and they want to smile again, they're having pain, I urge you to come in and call our office and get a consultation.
So they're crying happy tears.
Happy tears.
And you see that a lot? A lot of people get emotional about this? Like when it's all done or right before they're about to get it done?
This particular patient yesterday was crying before because we were helping him out. And then afterwards, they feel like they just are able to live again and chew again.
Are you ever surprised, like you do the procedure, you give them upper and lower teeth. Are you ever surprised of what a big deal it is for them personally? Like their reaction.
We're surprised a lot because sometimes they're crying and we have the family in the room and they come in and now they're crying because they know the other person was suffering. And then all of our team members and everybody can't help but shedding tears too.
You're a little choked up too.
Yeah, I'm always trying to fight it, but sometimes it comes out of me too.
Is that right? That's very nice. Do they ever want to hug you? Like you can't, like when you do fillings or root canals, they don't feel like hugging you. Do you feel like when it's all done, they're compelled to like want to give you a gift or bring you cookies or something?
All the time. We have patients that come in every time they come in for their 6 months cleaning. They're always buying us gifts. On Valentine's Day, we get so many gifts now from our patients that we've given them a brand new smile.
That's very nice. Okay, so no more dentures according to you. You have a 2-step process. Just to rephrase this, correct me if I'm wrong. Day 1, you get to meet them. You give them a treatment plan. If they decide they're going to move forward, you take measurements, CT scans, x-rays. The third appointment or second appointment is you remove their teeth, put in the implants, and give them teeth on top, and then they go home.
That's correct. Easy as that.
It's that easy.
It's that easy.
Okay, good. Well, I want to thank you for coming on the show. Excellent stuff.
Thank you very much.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.